I want to start something I find quite uncomfortable to admit. For the first 15 years of my career as a surgeon, I focused almost entirely on what happened in the operating theatre. The precision of the procedure, the technique, the outcome, and I genuinely believed, because I was trained to believe, that if I did my job well, the patient would recover. Then I had my own accident. I was seriously injured. I couldn't operate anymore, and I ended up becoming a psychiatrist. And from that new perspective, I started seeing surgical and cancer patients in a completely different light, and what I saw disturbed me. I remember one patient particularly clearly. Young man, mid 30s, software engineer. He needed thyroid surgery. Not trivial, but not the most complex procedure I had done. Physically, he was in great shape, no risk factors. The surgery went well, and then, post operatively, he fell apart. Panic attacks in the middle of the night, pain that wouldn't respond to the treatment that we usually use. He was physically healing. The wound was clean and the investigations were fine, but he was absolutely terrified. Every day I would come to see him on rounds and he would look at me with his wide eyed, desperate expression. Is this normal? Why does it still hurt? Am I going to be okay? It took him 3 months to recover from surgery that should have been just 4 weeks. And I realized we had failed him. Not in the operating theatre, before he even got there. Nobody had prepared his mind for what was coming. So when the pain arrived, when the exhaustion arrived, when the fear arrived, he had nothing to hold on to. No framework, no language for what was happening. Just panic. And panic physiologically makes everything worse. When I started looking at the research on this, I was genuinely surprised by what I found. There were studies, serious peer reviewed studies, looking at what happened when patients received psychological preparation before surgery. Not intensive therapy, just basic things. What to expect at each stage, simple breathing techniques, having a plan for the hard days. Those patients had significantly less pain after surgery. They left hospital faster. There were fewer complications and better emotional recovery. Same procedure, same hospitals, same surgical treatment, but different outcomes because their minds were prepared. And when I looked at it from the perspective of cancer treatment, the pattern held. I have now spent years watching patients go through chemotherapy, radiation, major surgery, and the ones who cope best are not necessarily the one with best prognosis. They are the one who walked in with some kind of mental preparation. To be honest, we spent extraordinary resources on medical technology, on drugs, on surgical techniques, and we spent almost nothing preparing the patient's minds. So let me tell you the three things that actually make a difference. So start with the first one. The first is information. Specific, honest information. No false reassurance, no vague positivity, real information about what to expect. Patients should ask their doctors, what will be the first week feel like for me? What time of the treatment would be the hardest? When does it start getting easier? What is normal and what should I be worried about? Write it down. Bring someone with you to write it down if you need to. Because when you're anxious, you won't remember it. I know this sounds obvious, but most patients don't do it because they are afraid the answers will frighten them more. And here is what I have found. The answers are almost never as frightening as what their imagination has already decided. Remember, fear of the unknown is always worse than fear of the known. The second thing is learning how to calm yourself down. This needs to be practiced before the treatment, not during. Because during panic, the real panic, the kind that hits in the middle of night before surgery, your brain is not in the state to learn new things. But if you have been practicing something for weeks beforehand, your body already knows what to do. The simplest thing I know is called box breathing. You take breath in for 4 counts, hold the breath for 4 counts, let the breathe out for 4 counts, and again hold it for 4 counts. 2 minutes. That's all it takes to shift your nervous system out of panic mode. It activates what we call the parasympathetic nervous system, the part of your brain that says, "We are not dying, calm down." And once that kicks in, pain feels different, fear feels different, your thinking becomes clear. Practice it now while things are okay, so that when you need it, you don't have to think about it. And the last thing, the third thing is knowing who is in your corner before treatment starts. Not who says, "Let me know if you need anything." Who will actually show up. Think about that seriously. Who can drive you to appointments? Who can sit with you when you are scared? Who can handle the practical things, the paperwork, meals, calls, when you are too exhausted? And who can you be completely honest with? No performance, no pretending to be fine. Make that list now. Have those conversations now, because in the middle of chemotherapy, you will not have the energy to figure this out. I want to say one more thing before I finish, and it's directed at people watching this who are perfectly healthy right now. 1 in 3, yes, 1 in 3 people will be diagnosed with cancer at some point in their lives. This is not something I say to frighten you. It's something I say because I spent years watching people arrive at cancer treatment completely unprepared, not just physically, but mentally. And I think about how much unnecessary suffering that causes. Am I right in saying that you don't wait until you have heart attack to start thinking about how to take care of your heart? You don't wait until you can't walk to start moving your body, right? So why wait until you are in crisis to train your mind? The 3 things I have described today: getting clear information, practicing self-regulation, and building your support. These aren't just cancer strategies, they are life strategies for any hard thing you will ever face. After my accident, when I had to rebuild my career and my identity, I had no preparation for that, no framework. I figured it out eventually, but it took years longer than it needed to. I would like you to have shorter path than I did. So please start now, even just one thing. Thanks for watching.